Namaste, welcome to Heartbeat episode, and today's episode is dedicated to the stress and heart diseases. Most of the time when persons come to us, they say that I was doing fine, probably due to the work pressure or due to the stress I am developing this hypertension and diabetes or whatever heart disease he has been diagnosed. So let us understand, really stress is one of the factor or it can lead to heart disease or not. So what exactly stress is? Anybody can be there on this earth who can say that he is not having a stress. When we take the body or we are acquired the body, what spirituality says, we are supposed to face stress. Stress is a normal thing, everybody has to face. What makes the stress more important to us, and which we have to understand, that stress happens when we are trying to control those things which is not in our hand, and then the things starts which we call as anxiety. So when you want to control which is not in your hand, in your capacity, like if you want to take an example that there should not be rain tomorrow because I have to reach to a particular place or my flight may be missed. So it is something which you are expecting and you are trying to control, which is not possible. You can just make a preparation that if rainfall is happening and I have to take a flight, what are the alternative way, whether I should go one day early or I should make an arrangement afterward, means somebody can present on your behalf with a reasoning. So getting stress is one of the reason we are trying to push a lot of catecholamine, which we call as the flight and fright hormones. So when it is releasing due to your anxiety or due to the chronic stress, it brings a lot of change in the milieu of the blood, starting from the blood stickiness to the metabolism to the endothelial dysfunction, even the oxidative injury, which is the first and the foremost important part of the atherosclerosis. So when you are giving stress or anxiety, it is pouring out catecholamines, and these catecholamines, if it is happening time and again due to some reason, what we call as a stress, it may change whole milieu and you develop the diseases like hypertension, diabetes, coronary artery disease, metabolic syndrome before the time. So catecholamine release is not a good thing. It is meant only to survive, because when the fright comes, you have to take a flight, means you have to run away. For that, this type of responses are there. Your reflex time will be less. But if you are time and again using this hormone, it may adversely affect the metabolism as well as it give the chances of developing the disease before time. This is one part. There are some situations in which people say that he heard some news or he gets some news from his family member and he developed heart attack. So this type of thing you may have seen in the movies also, that somebody has given some shocking news and he developed heart attack. So this type of things happens. So this is a very, very common thing, because whenever the catecholamine, what we call as the fright hormone, whenever it is released, there is a changes happens, and we call as there are plaques, means if a person is elderly or a person is even having any risk factor related to the coronary artery disease, these plaques may rupture and lead to the total occlusion of the particular one vessel we call as coronary artery disease, acute coronary syndrome, heart attack. So this happens. But there are some conditions which are very common in the females. When the shocking news comes, all of a sudden, even the coronaries are normal. The heart may dilate, its pumping may reduce from 60 to around 20-25. We call it the Takasubo syndrome. So stress can lead to various presentation. If it is in the chronic phase, it can lead to diabetes, hypertension, and other mental disabilities. But at the same time, if it is coming in the acute, it can lead to heart attack also. If it is, if the person is having a prone to coronary artery disease or having risk factors, and in some what you call females, or you can say persons who are prone to develop, we call as a stress cardiomyopathy, Takasubo syndrome, means all of a sudden a lot of catecholamine has been released and it compromises the heart function. Though most of the time patient recover over time, and even when we are doing the angiography, all the vessels are normals. So normal coronary, but it is the muscles which has been paralyzed by the release of the catecholamine. So we can avoid by controlling those things which we should control. If you are trying to control those things which is not in your hand, or you are not preparing for the adversity, certainly you are inviting the stress. So time and again Discipline is the most important thing if you really want to reduce the stress, and making your own schedules and not wasting the time for those things which is not essential. So essentials should be given the priority, because those things will certainly prevent the stress to happen when you are not expecting. So stress everybody has to face, and stress, the best management is to prevent it. And finally, if you are keeping stress for a long time, it will lead to other diseases like diabetes, hypertension, and in acute it may lead to heart attack and cardiomyopathy. So prevention is better than cure. With this information, we will meet you next time with some new topic. See you next time. Namaste.